Welcome back to the Gary Sutton Show on WSBA. By the way, we'll have that interview with Bruce Van Natta up tomorrow at facebook.com/910 WSBA. And I hope you enjoyed it. I thought it was an inspiring interview, and this next one might be as well. I had a chance last week while I was in the hospital to meet Dr. Peter Barkley, probably not under the best of circumstances, but he's a cardiologist there at the York Hospital. Received his medical degree from Penn State College of Medicine. He's been in practice for over 18 years. And he was the guy I had to kind of consult with at the end last week. We got to talking about things and struck up a conversation about taking care of your heart and some of the things you can do with that. And I learned an awful lot in the short period of time that we were talking. So I said, hey, would you be on the program with me sometime? He said, yeah, Tuesday's my day off. Give it a shot. So we welcome this morning Dr. Pete Barkley to the Gary Sutton Show. Dr. Barkley, great to have you in.
Thanks. I'm glad to be on the show.
Nice to be talking with you on my terms, too, this time. So anyway, but yeah, it's, we were talking last week, and one of the things that we got into a little bit was, taking care of your heart. A lot of us at this age, 40s, 50s, your whole life you want to do that. But you were talking about, in my business, and you were specifically talking about talk radio, you're sitting a lot, and just getting up and getting a walk in during that time between breaks and so forth is important. Tell us a little bit about, a lot of people out there are following all kinds of regimens for exercise, and yet sometimes just getting out and taking a walk or walking a little bit is something that's going to help you.
There's no question about it. I mean, a lot of us have jobs that can be sedentary, where we're just by need of our job sitting around and not burning a lot of calories. For sure, it's been shown that not only for a calorie burning standpoint, but just for the health of your heart, it's important to stay active. And the American Heart Association recommends at least 30 minutes of moderate intensity activity about 5 days per week. I tell my patients about 30 minutes a day, most days of the week, of moderate activity. It doesn't matter if that's really all in one chunk or if you do it over several small pieces, but it's just really important to stay active.
Let me ask a question from inside out here. When you're looking at the heart, and a lot of people say, okay, let's just talk about the heart for a second. There's a PSA on our station that talks about the heart, talking to your body, say, hey, listen, you're laying around, you're not doing a lot. When do we stop working out? What is the heart asking for there? I know it sounds like a strange question, but the heart is sitting there, and obviously that's the most important organ in our body. What's it really asking us to do on a regular basis?
I think that's a great question. I mean, the heart, simply put, the heart's just a pump, but it's a very special pump, and really our heart is used obviously to pump blood through our body, and it changes and adapts to the needs of our body. And when we're not active, our heart suffers as a result of that, and the inactivity can promote problems with diabetes, obesity, hypertension, coronary artery disease, and all those things are risks to our heart. Yeah. And we see people in the hospital all the time with coronary disease who have chest pain and heart attacks, and we can drastically reduce the chances of that occurring by eating right, by staying active, by watching our blood pressure, our diabetes, and really improve outcomes overall.
We hear a lot talk about, blocked arteries and things like that. And again, I don't want to sound too simple on this, but I'll let you get into more complicated stuff you need to. By doing all that, you're keeping those open. I mean, you really are, the combination of all the things you just mentioned, you really are just keeping those lines to the heart open on a regular basis, right?
Yeah, there's no question about it. I mean, that activity on a regular basis helps prevent heart disease. It drastically improves lifespan and decreases hospitalizations, and certainly makes people feel better. I mean, in all the years I've been in practice, when people start walking and they do that walking program, I've not once had someone come back to me and say, I really didn't like that walking. Everyone comes back and says they really enjoy themselves, they feel better about everything, and just that level of activity overall improves quality of life.
I asked you a question last week, and I don't want to violate any HIPAA laws, but I'll say what I ask you. And you said there might be a chance for some coronary disease there in your heart. And we were sitting there talking, and I said, is that reversible? And you gave me a great answer. You said, "Yeah, it is. You're on the right path."
Yeah, there's no question about it. With medications, with activity, with dietary changes, there's no question about it. We can stabilize and improve that the picture there. There's no question about it.
So you started a walking program. Now a lot of people don't know, but you also were a football player at Princeton University as you were going through. And
that was quite a time ago.
Yeah, quite a time ago, but that's all right. It's talk a little bit about the program you got started, because I said it's not only a great way to kind of keep your heart in good shape, but it's also a great way to see York County.
No, I appreciate you bringing it up. I think I've been here in York County since the late 1990s. My wife is a lifelong York County, and most of her family's from York County from way back, and I just really like the place we live. I enjoy York County. I think it's a beautiful part of the state, and there's a lot that the county has to offer. And when we talk about, York County has some of the negatives that we hear are, people from York County aren't active. They don't eat properly, but we have a lot of opportunities to improve upon that because we have such a nice place to live and a lot of opportunities to get out and walk. So the walking program started with the idea that that York County has a lot to offer, and there's great places to exercise. So we started with really a grassroots kind of a campaign to invite people out on a walk, and we started with our cardiac rehab. Some of our cardiac rehab patients; those are patients that may have had a heart attack in the past or have had bypass surgery, and we try to highlight different places in York County to walk. We started with Rudy Park. We moved to the rail trail the next month, and we're in our third time coming up here on November 25th. That's a week from today at 1 o'clock. We're going to meet at Rocky Ridge. Hopefully the weather will hold out for us. There is a rain date for early in December, but it looks like the weather will be good. But Rocky Ridge at 1 o'clock, we're going to walk, and it gives patients an opportunity to get out. We can talk about fitness. We can talk about cardiovascular health. They have access to me the whole time. I'm happy to answer questions as we walk along, and we also have Dr. Larry Shears, who's one of our heart surgeons. He's going to be walking along with us at that time. So it's a week from today at Rocky Ridge at 1 o'clock.
And where do you meet up there? You meet up there in the parking lot at the top of the ridge?
Lot. Exactly. Yeah, exactly. And there'll be signs guiding people into the proper lot, because there's a few parking lots up there.
Sure,
but it's a beautiful place. Beautiful place to walk, and I just think that York County has so much to offer, and if people get a sense of all that, certainly we have a lot of active people that utilize that, but I'd like to expose it to more people, certainly heart patients who would greatly benefit from the walking.
I can hear people right now out there going, geez, can I keep up? Will I be able to keep up with this? Tell us about that.
That's a great question. There's no question about it, and we walk at the pace of our participants. I mean, certainly Dr. Shears is a marathon runner. He will be walking with the people there. But it's a nice environment. We have nutritionists along. We have cardiac rehab nurses. We have a athletic trainer and physical therapist that come along that help us with some dynamic stretching exercises that we do beforehand, and they're all available to talk, and you can bend their ear about questions about nutrition, about anything you can you want to ask. Really, I think it's just a nice forum. It's a comfortable environment. It's very casual, and it shouldn't be any real stress involved with it. And we walk with everyone.
Well, I like the idea. I walk sometimes over on the Memorial Hospital Trail, and they have all kinds of signs along the way that you just kind of remind you of things. And I think it's good to be able to walk out here in this situation with people and be able to tap on them and say, by the way, here's what I'm doing dietary wise. Here's what I'm doing exercise wise. And you hear a lot of things that are kind of sometimes that are myths or not myths. And you get to kind of separate those out too. I think for a lot of people to get all this information thrown at you all the time on what fitness really should be.
Oh, right. Yeah, and we have great conversations with patients, and sometimes it's just fun talks about the non-medical things. It's just a nice way to get outside and to walk, and we certainly try to do our best to encourage people to make that a regular habit. Like I said before, people when they do it, the folks love it, and really everyone who's participated in this kind of thing and who's kept up that regular program of walking, when they are able to squeeze it into their schedule, it becomes a vital part of their schedule, and they really don't like to alter it too much. And
for people that
feel better.
For people that can't do it, one of the things I do is I work a lot in a pool, and I love to walk in a pool. I'll do like 75 like up and backs in a pool with some mild resistance. Some people that can't get out for that, anywhere that you want to walk right now is really a good thing. I mean,
no question about it. No question about it. And the pool activity is fantastic if you have access to that. If you have access to that type of
right.
facility, there's no question about it. Then the walking in the pool adds that much extra resistance, and it's really that much more exercise than a brisk walk without the water. It's fantastic exercise.
So next Tuesday, 1:00, Rocky Ridge. And by the way, I guess people probably get a little look at Christmas Badger before it gets all lit up,
That's
too,
right.
because they're
That's
almost
right.
done with that now, I know.
Yeah, that's right. It'll be nice. It's a nice time, and our intent is to continue this once a month, and hopefully get more people to enroll. There's a number to call. They can call 741-8267 to register. It's free of charge, of course. We always bring bottles of water for folks who are participating if they need it, and we'll plan to do this once a month, and the location changes. So December we'll plan to, depending on the weather, we'll likely try to squeeze one more outdoor walk in, and then we'll move inside. We have a walk planned. January will be at Apple Hill. In that facility, probably in the morning. That hasn't been ironed out yet. There's some indoor facilities where we can walk in York County. Certainly, the Gallery is another choice, and then we'll move it back outside. And my intent is to move around the county and to highlight nice places in York County. And I'll be inviting local folks along. And we'll really encourage everybody to come on out and talk to us and get active.
So you're becoming kind of the health Ram McNally there for us, right?
Trying to. Yeah, I'd like to just get more people out. It just benefits everyone. It really is, and everyone will feel better.
I will try to join your group next week. I'm looking forward to trying to get out there and have a walk with you. So I've been working on that myself, and
terrific.
But I'm not fast. I mean, I don't know.
We'll walk you, and everyone's at different speeds. We have folks of different ages. I mean, really, the age range is varied, and the people's abilities is varied, and we have enough folks. We walk with everyone.
Yeah, that'll be a lot of fun. And again, that's at Rocky Ridge next week, and that will be at 1:00.
1:00,
right up there in the parking lot. Just follow the signs on in there, and you get a chance to take advantage of Dr. Peter Barkley, and so many other people are going to be there as some help also. Doctor, really good talking to you. I really appreciate you taking the time to be with us, and I hope we can follow up on this again.
I really appreciate talking to you as well.
Thank you so much. Take care now.
Take care, sir.
Dr. Peter Barkley with us here on the Gary Sutton Show, a guy I saw last week in the hospital. I just kind of thought it was an interesting thing he was doing with the walks, and he's added other people to them now to get out there and you can use as resources. So next week, 1:00, and you can give a call. Write this number down, 741-8267. That's 741-8267, and that's next week on November 25th, on a Tuesday. You get out and take a walk up at Rocky Ridge Park, which Christmas Magic is going to be there, and I'm going to be up there later on. We'll tell you about that later. But just a great chance. I learned a lot from him last week. So if you're not walking now, get walking. Do something. 30 minutes a day. Just think about this. Is taking 30 minutes a day for yourself a bad thing? I don't think so.